thanks for staying with us. We have a sponsored segment from Sterling Bank. Thanks for, so Sterling Bank, in collaboration with the Lagos State Health Management Agency, LASHMA, strategically set up medical booths in informal business areas, which will serve as initial access points for basic medical care. Joining us on the show to shed more light on this is the Divisional Head, Business Growth and Transactional Banking, Sterling Bank, Mr. Obinna Ukachukwu. Welcome to the show, sir.
Thank you. Good morning.
Good morning. So we see that you're collaborating with LASHMA. Tell us about this collaboration.
So we partner with LASHMA to get to improve the access to care, healthcare services to the most vulnerable part of society. Now, usually when we talk about delivering healthcare, improving access to healthcare, many times we tout telemedicine as an option, but we discover that many people don't even have access to these telemedicine platforms. Data is expensive, and they don't just get what they need to get when they get on these platforms. So we decided to bring telemedicine to the people. So it's like a physical and digital approach to lowering the barriers to access to care. Secondly, we thought, again, we looked at the society, and we know that a lot of people leave their houses in the mornings to informal business segments, informal business, where informal businesses converge in the markets, in the motor parks. And when they're sick, they usually wouldn't want to leave their business areas, go back home to get care. That's why they resort to, what's it called? Self-medication, and in some cases they allow their health state deteriorate to a point where when they now have access to care, it becomes too expensive. So what did we decide to do? It was to take these health services into the middle of where they do their businesses. So if they just feel sick, they can walk into the health booths and get care and go back to their businesses.
Okay.
That's what we partnered. That's why we partnered LASHMA.
Okay.
Okay. So what's the inspiration behind the Ilera booths and the Eco Health booths?
Idea, like I said earlier, the idea was to lower barriers to accessing healthcare. We wanted people not to deteriorate so much in their health before they access care. And that's why we brought this solution to where the businesses converge. That's pretty much the idea. But again, you see, the reason why it is a LASHMA initiative is that we know that there is no way you can sustain healthcare delivery in a country or in the state without health insurance. So people are not required to pay for care when they actually need care, but they're required to contribute a little when they are well, so that when they're sick, they can actually have access to care. And that's why we had to merge the demand side and the supply side together, as in we had to bring them together in something like a consortium to ensure sustainability of the initiative.
Okay.
So I wanted to ask about how does Sterling Bank identify the different courses that they want to go into partnership and innovation with?
Oh, so generally, Sterling Bank, we serve human beings, and if there are no human beings in Nigeria, then Sterling Bank would not exist. And Sterling Bank believes that for you to serve human beings well, the human beings need to be alive, they need to be productive, the businesses need to be efficient. So that's why we sort of major on 5 pillars. We've got the health, we've got education, we've got renewable energies, we've got transport, and we've got agriculture. So the pillar is called the heart strategy of Sterling. Everything that concerns that human beings use to become alive, to be alive, and to sustain their businesses. That's what we're quite heavy on that in those sectors. If you look at in the transport sector, we had partnered Lagos State on fair pay We currently are the ones partnering Lagos with the Lastra ID cards that will enable people to just tap and pay for their transport fees. And across the country, we have been partnering different governments in development of sustainable healthcare systems. In Bayelsa, we had established a very efficient drug revolving chain that ensures that people in hard-to-reach areas have drugs when they need them. We've done a lot with Cross River. In fact, the first drone service in Nigeria that delivers health consumables to hard-to-reach area. Sterlingbank was part of the consortium that launched that in Kaduna. So anything that really keeps people alive, that impacts the life of the people we serve, we like to enable. We vote for it, and we enable those sectors.
Okay, so what impact do you anticipate the Ilera Eko healthcare booths will have on the Lagos community?
A healthier community, with the Ilera Eko Booths, and you remember when it was launched, the revised NHIS Act says that everyone must have a health insurance. And of course, in Lagos State now, with the executive order, everyone in Lagos State needs to be in the health insurance pool. We expect a healthier community, that's number one. We expect the unit cost of delivering primary health care to go down significantly. As a result of this, we expect a deepening of the health insurance pool across Lagos State as a result of this, because yes, we've launched 5, we're going to 300 locations across the different local council development areas, local government areas in Lagos State. It's just like bringing health very close to where people stay. People converge every day. It's also going to lead to the reduction in self-medication, because there is no need going into the pharmacy to get the self-medicate when you can quickly walk into a booth and talk to a doctor.
Right. So when Nigerians see Sterling Bank partnering with Ilera Eko, they're thinking, okay, are they going to sort out affordability? Is it going to be accessible, easier, cheaper to access this booth without having to pay? So could you tell us a bit about the affordability of this service with Ilera Eko?
Yeah, to actually access the service at the booths, you need to be on the standard JARA plan that was launched by the Lagos State Health Management Agency. In fact, I usually give the Lagos State Health Management Agency a thumbs up. They pretty much lead in most of these access to care initiatives across the country. Dr. Zamba is doing a very great work in that particular department. We have, in order to enable the spread of their plan, what we've said is we're going to make it possible for people in the market to pay in bits. At the moment, people can pay per month. I think it's less than 2,000 naira per month, but we're going to a stage where we can collect as little as 100 naira every day, as little as 80 naira every day. So we're going to make it, through Sterling Bank is going to enable people pay very little consistently in order to access the service there. So it doesn't matter whether one can cough out 15,000 naira, 18,000 naira, whatever it is, at any point in time. But we will enable them to pay, even if it's daily, for these to get access to this care when they're sick.
Yeah, so what initiatives are you putting in place to ensure that every segment of the society is aware of this Ilera Eko booth?
Well, first, we're talking to you here.
One.
We shouldn't be taking it, that's one of it. We're taking time to educate everyone that this is not an elite thing. It is real. Okay. The government and the private sector, we have come together to say, we want this access to health to happen. We want it to work. We want it to be sustainable. And that's why you have a huge private sector play here. So it's irrespective of the cycle of government, the private sector is here. And that's why the government actually chose to partner with the private sector. We're going to go around the local council development areas, around the local government areas, around the markets, making the campaigns, educating people to say, you think you're well, but if your neighbor is sick, you really are not well. So you've got to contribute to the pool to ensure that your neighbor can get care when he's sick and you can get care when you're sick. Healthcare is something that we don't expect people to be taking care of their health and also be looking over their shoulders for their finances. And that's why when you're well, when you're active and working, you should be able to set out a little sum periodically so that we can take care of you when you're sick. This really, beyond the standard JARA plan, we're going to lead the charge for education on why it's important to the individual and the community that healthy people that are working pay for health care in order to get care when they're sick.
Okay.
Okay, so I wanted to ask about how widely spread are these booths? You know, where are they currently positioned, and what's the target to have more? Where are we expecting to see them?
We launched with 5 booths currently that are fully operational, and we're going to 300 in a very short while. We will be coming back here to tell you when we hit the 50 mark, the 100 mark, the 300 mark, and it's going to be around the local council development areas. It's going to be in markets, in wherever you've got businesses converging, small businesses converging. We're going to put those booths there because that's actually the target, to ensure that people don't need to leave their businesses. We support businesses. We don't expect them to leave their businesses when they're sick. They should be able to get care when they're sick.
Okay, so the booths, I hope they are situated close to a hospital in case there is an emergency case or something that the doctors in the booths will not be able to handle.
Oh, yeah. So, you see, there are not even physical doctors in the booths. The doctors in the booths are virtual doctors. So we've created a system where, yes, you've got a community health worker, but you've got a screen where you can speak to a doctor. Now, these booths are mapped to different hospitals in quote. We sort of geo-map them, and the people that are participating, that use the services in this booth, already have a primary health physician where they are registered to. Gotcha. So we've created those links, and yes, they exist. We've really thought about this, and we've talked about the sustainability too. That's why earlier I said there's no way we would have invested in putting this on ground if it's not tied into insurance, because it's only insurance, health insurance, that can make for sustainable healthcare development and services.
Okay, so I mean, finally now, so somebody is listening to you and saying, okay, they're going to look out for one of the booths. So what's the procedure? Do they have to go to Ilera Eko's website to register before they pay the insurance, before they know that they have access to the booth? What's the next step? Now that they've heard you?
First, they can just go into the booth and get registered. And secondly, they can go into Ilera Eko, the Ilera Eko website, and get registered. And a couple other partners, I know Ilera Eko has a couple other partners that help them to distribute the services. Those details are on the website. So you can register on the website, and you can just walk into the booth and register. What I'll tell everyone is just look out for a booth near you, and if you don't have one near you, one is coming close to you very soon.
Thank you very much, Mr. Obina. We're speaking to the Chief Growth Officer, Sterling Bank. Thank you very much for joining us this morning.
Thank you so much for having me.
Let's go on a short break now and come back and move on to our next segment. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.